Hello everyone. Today we'll talk about DMO, disaster medical operation. I hope everybody understand what is medical, what is disaster. Both goes hands in hands during any event or operation perhaps. So agenda is simply to understand what are the three killers altogether, apply techniques to open the airway, control bleeding and treating for any shock. So there is a shock that happens. People are unable to cope up with the situation or come up with the appropriate reaction. One, treating for shock, bleeding, excessive bleeding, if blood effuses out from your body, what to do, and probably the other ways is about all your airways that gets blocked in. So conduct this triage under simulated disaster condition. Remember, we are looking for only one thing, greatest good for greatest number, and that is what is the must go motto for any disaster or crisis management perhaps. So three killers. One is the emergency medicine killers in terms of airways obstruction when you are unable to take breathing, excessive bleeding and shock. Priority wise, open your airways. And how do we go around it? How can we open our airways with the things? More often than not, what happens is your tongue goes back, and as a result the airway goes black, gets blocked. So you need to understand how to remove or probably forward your tongue or insert a pipe so that the blocked tongue can pass the air through into it. So that is what we are looking into it. Excessive bleeding is when we can puncture. If there is a certain vein that has been punctured, probably you need to tie it up and block that blood from oozing out. Treating for shock is when the blood pressure rises here and there. So how to approach a victim? Be sure that victim can see you. The victim can know that there is a person who is approaching, who's only going to help and not going to harm him or her. Point headlamp down, not in their eyes, but probably down so that they can see your faces. Identify yourself, your name and the name of your organization. Request permission to treat if possible, implied consent. Respect cultural difference. That is what we looking around here. So, open airways, as I said, the nasal cavity and your tongue. This is where the pharynx and the larynx is there, where your passes around it, and this gets blocked because of your tongue that goes around it. Your lungs are not able to access to any oxygen. So, what does it to be done, and how do you want to go across it? And that is what needs to be understood time and again. So, did I say about the tongue? This is the tongue, a normal condition. The air flows out from your noses. See, the air flows out simply. But what happens when it get unconscious? Your tongue, the muscle get relaxed and probably it slits back, and there's a blockage out here. This is known as an obstruction that goes around it. So you see a person awaken, a normal fellow, a person unconscious. What happens? So either what you have to do is either put a pipe from here till this point, or you just need to pull the tongue along with it. So what you can do is you can tilt the chin. This is the way you want to tilt the chin so that your tongue gets, see what is happening with the tongue, you're elevating it all together. So types of bleeding, then we have something called arterial bleeding, bleeding from artery spurts and it goes out and out. Venous bleeding, bleeding from veins flows. One, artery is where the blood is going into the heart, and venous is from the blood, the heart is pumping out the blood. And then there's called capillary bleeding, bleeding from the capillary oozes around here, and that is what needs to be understood. See what is happening with artery building. Absolutely, yes. And the venous building as on venon basis. And then there's capillary, which is probably on your skin and things like that goes around here. So this is primary bleeding with full forces. Primary bleeding, full forces. This is capillary is the secondary bleeding that happens around it. And how do we go around? Three main methods is all about controlling bleeding is your direct pressure that comes around it, elevation. If it is a hand which is bleeding, look, we have elevated it. If it is a leg it is bleeding, just elevate the thing. Or probably the pressure points that will allow you to stop the bleed, and that is what is most important. Next is all about bandaging. The dressing, the absorbent material played on the wounds, as been shown by the PEC. It holds the dressing in a place, provides direct pressure over the wound, help reduce swelling, can make bandages out of any clean cloth, any clean cloth. Remember, if the cloth is breathing, nothing like it. If it is a cotton, nothing like it. So pressure points, if you look into it, the branchial pressure is right at your arms around here. This is what you want to go around here, and this will help you to ensure that the blood is not moving around it. Then there is something on your hip, on your knee bones, the popliteal pressure points behind the knee altogether, and in the upper thighs zone. This is the femoral pressure point on the upper thigh zone. These are the three pressure points which you can press probably to block any kind of bleeding per se. Sure, this is where we're talking about blood pressure high, if it is cases might be result in ineffective circulation of blood. Remaining in shock will lead to the deaths of cells, tissues, and entire organ, as the case might be. That is what we need to understand time and again. Shock, ineffective circulation of blood because of blood pressure, which actually leads to death due to cells, tissue, or entire organ failure, perhaps. Now, recognition main sign is a rapid and shallow breathing, which is more than 30 times per minute. Rapid or shallow pulse, which is more than 100 per minute. So once is a breathing more than 30 times a minute, or the pulse, if you can measure the pulse, usually normally the pulse rate is around 72 to 80 for a normal person, but if it exceeds 100, your heart is beating innumerable times per minute. Capillary refill of greater than 2 seconds, that's a Blanch test. An altered mental status where there's a hallucination, probably the person is incoherent, failure to follow simple commands, as the case might be. These are the symptoms of the shocks. Pay careful to your patient. Procedures for controlling shock. Maintain the open airway, as I just stated earlier, how the tongue actually blocks your airways. Control obvious bleeding. If there are any visible bleeding, how do you go around it? Pressure points, bandages, block it out, increase the altitude. Maintain body temperature, avoid rough or probably excessive handling, and do not provide food or drink at this point of time. Stop the bleeding is where you can utilize a tape which can help you uh, connect and probably folds you. Also, please ensure that you put in the times at what time did you block it out. So the next person, who the doctor, the medical person, the paramedical forces who might be removing this band, will know at what time it was put on, for how long it has not been, this part of the body has not been able to access blood. Stop the bleeding is the number one causes of preventable trauma death. By presidential directive, first responder, military, doctors met to determine best method to decrease mass casualty deaths. How does it goes around it? Program to focus on educating citizen, first responder to apply immediate aggressive treatment to stop profusing blood. Methods can be painful, but believe me or not, it is beneficial and helpful in preserving life, and that is what we look into forward to it. So bleedingcontrol.org and dhs.gov are the two websites that goes around, which we will talk around here as the passing things comes all together. Now stop the bleed procedures. Ensure own safety. Call 911 or any helpline that your federal government prescribes. Find injuries, remove clothing if necessary. Act cover with dressings. Apply direct pressures. Pack the wounds with gauze, clotting, remove all the blood whichever is coming, but don't remove the clotted one. Apply tourniquet if available, the band that I just showed it to you, if available on the limbs. Now this is what we are talking about here. Apply pressure with hands, apply the and gauze the pressure. If with a tourniquet, wrap, wind, secure, and time. I have already told you a number of times the time you are just wrapping it out. Stop the bleeding is find the wound, immediately remove clothing if necessary, cover the wound area with a clean cloth. If the wound is large, pack it up. Apply pressure on both hands. Ensure that not excessive blood has been removed. Now, what happens if the wound is very large and very deep and not on torso? It is on one of your limbs. Wipe off the pooled blood, but never, as I mentioned around there, never the clotted blood. Let the clotted blood be taken by the expert. As a first responder, you should only look into what can you do so that it minimizes any negative impact. Pack the wound with clotted combat gauze, preferred plain gauze or a clean cloth perhaps. With tourniquet, it is very easy. You need to use it only on the limbs, tighten the wraps twice or thrice, probably twist. This is what the twist is coming until the bleeding stops. Secure the windlass and time it down. Time it down. Always time it down. To the mass casualty and how does it go around it? Always have a plan and follow that plan. Do not change your plan. Document your action throughout. Keep calm and document everything as on when on basis. What we are talking about is FAPAR, fact, anticipate, plan, act, and review. What we are looking into it first, what are the facts, gather them. Anticipate what are the various options that is going to it's going to happen. Anticipate, plan according to each option, prioritize them, act upon them, and review them if things have been working continuously over a period of time. Triage, the victims have been evaluated. If you look into it, victims are sorted on the basis of priorities, urgency, the medical attention that the victims are required. Victims are set up for accordingly for immediate treatment or deferred treatment as the case might be. And that is what the triage is all about it. Remember, immediate victim has a life-threatening injuries, airways blocked, excessive bleeding, or there is a blood pressure fluctuating, the shock. Then we have the delayed injuries can jeopardize the victim's life, but treatment can be delayed. It is not on a priority number one. Minor, probably the not only the person, the victim is injured, but probably is awake, conscious, walking, mobile, and probably is able to take care of himself or herself. Dead, no respiration, even after two attempts to open the airways. Now, these are the tries that goes around here. If you want to band it out, based on your requirement, based on the federal government, which is of the priorities, whichever band that you put it on your victim, perhaps. Rescuer safety during the triage. If hazmat is hazardous material or terrorist even is suspected, the CERT members, the certified central emergency response team, do not respond. Evacuate for the safety first. Always wear PPE, a protective equipment, people protective equipment, which is helmet, which is goggles, which is N95 mask that goes around it, work gloves, sturdy shoes, boots, non-latex exam gloves, as the case might be. So all your body should be perfectly covered. At least the first responder or the caregiver should be protected in the first place before things can be worked out. What is a START? START is simply ST for simple triage. ART is for and rapid treatment. Simple triage and rapid treatment is what START is all about it. ST simple triage victims marked based on the priority. Remember the ribbons that I showed you, black, yellow, red, green, include the voice triage. Art of the START is and rapid treatment. Rapid treatment of the three killers. Three killers are what? Your airway blockage, your bleeding, and your shock. Centrally emergency response teams tries and treat the scene at the same time. So start process is simple. There are 6 steps to it. Stop, look, listen, and think. Then probably conduct a voice tries, speak among yourself, and understand what is to be done. Start what you are, where you stand. Follow systematic group. Step number 4 is evaluate each victim and tag it accordingly on immediate basis or a delayed basis. Treat I the red victims immediately and document the triage possible as much as possible as on when on required. The triage decision is simple. If you look into it, assess the position, always check the breathing. If it is no response to the airways, what can be assumed? If there are no responses, he or she or victim is might be dead, or probably if responding, you probably need to tag it as immediate or I. If position check breathing is breathing, then probably check what is the pulse rate, right? Once it is above 100, or what is the breathing if it is more than 30. If there are something goes wrong, if it is more than 30, tag I or immediate. If it is less than 30, it can wait for a delayed treatment. Similarly, for step 2 is look for the circulation of blood or bleeding. If there is a blanch stage or a radial pulse stage, if you can go around it more than 2 seconds, go for immediate. Is less than 2 seconds, check for the mental status, talk to the person, talk to the victim. Is he or she responding, or there's an hallucination, or there is a mental block out there? Step 3 is a mental status, fails to follow simple orders, you go for immediate treatment. Follow simple commands, probably able to respond, you go for a delayed response thereby. So triage pitfalls, what are they? There are no team plans. organizational goal, indecisive leadership, as on one-on basis, what you believe, so what you believe with the victim, and how do you prioritize based upon your knowledge and based on your gut feeling, is what we are looking into it. Treatment rather than triage, perform for non-life threatening injuries as on when-on basis. So the summary bound of it, we have identified the three killers, applied techniques for opening the airways, control bleeding, treating for shock, conducting the treatment under simulated condition, and that is what we are looking as far as CERT is concerned, the Central Emergency Response thing. With this, I come to an end of this presentation. Thank you for watching this video till the end.